My response is to Kaila Horn with her presentation on AML, acute myeloid leukemia. Working on the blood cancer floor at the Markey Cancer Center, I do often take care of AML patients. They're a large portion of our patient population. I have had cases exactly like the one she explained, and very similar. And I don't know that there was anything that surprised me, but I would say the most important thing that she talked about was infection and risk for infection, and how I think sometimes people take that for granted. We had a lady just recently on our floor who had a 13-year-old daughter, and of course if you've ever been to our floor at the hospital, you know that especially during flu season there's nobody under the age of 18 that's allowed to visit, and it's hard on a lot of people because they have children that are younger than that, and it's hard for them to miss them and go without seeing them. And it's not that we're not sympathetic to that issue at all. It's really hard to tell someone, oh hey, I'm sorry, I know you guys have come a long way, but you can't be here and you'll have to leave. And but we do it for a reason, and it's to protect people like Kayla's patient that has AML, whose absolute neutrophil count is at 0, and they literally don't have anything in their body that can fight anything off whatsoever. And there was a lady on the floor a week or two ago that her husband had tried to sneak in their 13-year-old daughter to see her, understandably, but that puts her at risk, and it puts really everybody else on the floor at risk as well. Because if you're 13, you're going to school, you're catching a lot of germs, and they just aren't able to fight things off the way that a normal, healthy person can. And what happened was they threw such a fit that we would not allow their 13-year-old daughter to see her mother, who had cancer, was in the hospital and missed her very much, and they ended up, the woman demanded to be moved off the floor, and she was, and she died a week later from infection. Now, is it her daughter's fault, or did she get the infections in some other way? We'll never know. Would the same course have happened with or without that visit, or with or without having been moved off the floor? It's hard to say, but those visiting rules are in place for a reason. Risk for infection is probably their number one thing to be afraid of, because they can't fight it off. If they get a virus or a bacterial or fungal infection, it's life and death for them. And I think sometimes we forget that those rules are in place for a reason, and it's for their safety, not because we're trying to be mean. But Kaila, good presentation.